Good evening, everyone, and welcome to today's session. 3 minutes. Can we be able to make revision of one concept which is frequently tested in the entrance exam? That is going to be the challenge. I'm going to give you thousands of videos which are of 3 minutes duration. Let us start the game. One of the favorite areas for the examiner that you need to be very sure is mastectomy. So now the question comes. Simple or total mastectomy? What is the meaning of it? Removal of the breast tissue, nipple, areola complex and the skin. Extended simple mastectomy. So what is it? What does it include? Simple mastectomy plus the removal of the level 1 axillary lymph nodes is called extended simple mastectomy. What is modified radical mastectomy? Removal of the breast tissue, nipple, areola, skin and level 1 and 2 axillary lymph nodes. Then what is Halstead's radical mastectomy? It is the removal of the breast tissue, the skin, the nipple, areola, pectoralis major, minor and the level 1, 2 and 3 axillary lymph nodes. Then what is extended radical mastectomy? Radical mastectomy plus the removal of internal mammary lymph nodes is called as extended radical mastectomy. Then what is super radical mastectomy? Radical mastectomy plus removal of the internal mammary, mediastinal and supraclavicular lymph nodes is called as super radical mastectomy. Good to see Suhani, Pathak and Swapnil. So you should be very sure there is no dissection of lymph nodes or removal of muscle done in the case of the simple mastectomy. Whereas, if you take the modified radical mastectomy, there is a removal of the breast tissue and the axillary lymph nodes, and there is no removal of the pectoral muscles. Then modified radical mastectomy has got patties, scanlons, Auchincloss are the 3 different modes. So, what do you do in Halstead's radical mastectomy? It is much more extensive. Breast tissue, axillary lymph node, pectoralis muscles are also removed. But the main disadvantage is it leaves a lot of scars. Similarly, you can do subcutaneous mastectomy, skin sparing mastectomy, and breast conserving surgery like lumpectomy or quadrantectomy. So, one of the favorite questions asked by the examiner is, what are the indications for simple mastectomy? What are the indications for radical mastectomy? This is one point frequently tested in the NEET PG. Stage 1, stage 2A carcinoma. They are the indications for simple mastectomy. And the large cancers which are persisting after adjuvant therapy is an indication for simple mastectomy. Similarly, multifocal, multicentric carcinoma in situ is also the indication for the simple mastectomy. So this is the typical simple mastectomy that you need to remember. Then modified radical mastectomy. Any locally aggressive breast cancer or a residual large cancer which is persisting after adjuvant therapy or a multifocal multicentric disease is an indication for modified radical mastectomy is what you need to remember. So that way 3 minutes, of course we took about almost 5 minutes, but 3 minutes you should get the gist of the concept. And you also, while preparing you can start uploading your 3-minute videos. In another 1 week, we are going to launch Incus Train app, just like TikTok videos, short videos, lot of short learning videos every user can upload, and that way you are helping millions of students across the world to learn while you are doing the revision. So look forward for that. Thank you. And every time opportunity comes, I keep uploading 3-minute videos, and just bookmark this, subscribe to this channel, youtube.com/online MBBS, so you keep getting a notification. Thank you for joining.